We've been using EQ protherapy for various problems with our athletic horses, rehabilitation and treatment, since 2019. We use it primarily for proximal suspensory and branch injuries in the athletic horse. But more recently, I've done cases such as a biceps brachii, desmitis, and I've also done one that involved a ligament in the hind femur. Normally you don't need sedation. It just requires a little bit of contact gel, and it is warming to them, and so it actually feels quite good. It feels a bit like a massage that's warming the tissues, so they tolerate it very well. I've been very happy with the results. We've seen good results with tendon and ligament injuries and also in muscular areas up in the back. One of the areas I've been treating lately on a horse is a superficial digital flexor cap on the calcaneus, and this is slipping. And I've tried treating this with various other modalities, and recently we've started adding EQ Pro ultrasound therapy, and we've been pleased with the results so far. We're not done treating the case, but it seems very promising at the moment, and we're looking forward to growth. We've been very happy with the results. We've used it, like I say, ligaminously and up in the back as well. From
ultrasound, you have thermal effects and you have acoustic effects. The acoustic effects are the sound waves going through the tissues. So I suppose the simplest way to put that is it's like micro massage going through your tissues. So if a massage feels good to you, this is going to get way past the skin and into deeper tissues. And when you think of the size of a horse's muscles, you're not talking centimeters, you're talking inches. And so now you can get deep into that area to really affect something on the horse. The other effect is the thermal effect, which the idea is to help bring circulation in. The acoustic probably does some of that too, but the thermal effect warms the tissues. And based on some work that I've done using thermal imaging, which yes, only measures superficial, but the thermal effect I'm getting is much wider. If I do like the thigh of a horse, I see the whole quarter of that horse warm up. So that's must be affecting deeper tissues to get the blood vessels to dilate to give me that. Based on other work I've done, I think muscle injuries are much more common than given credit for. It's certainly muscle injuries are the most common injury in human athletes. So our horses, they're better athletes. So why don't they have a lot of muscle injuries? And I think they do. We just fail to recognize them. As a veterinarian, I think you just need to recognize where these issues are, concentrate on it, and get that horse moving a little bit better. And this is where I'm using it. I couldn't be happier with EQ Pro. I've known about low frequency ultrasound for some time, but you couldn't find one till I found it. And I'm ecstatic. If you're doing sports medicine work and you're doing real sports medicine work, if you're really looking after athletes, this has got to be part of your toolbox.
On show horse medicine, and so we tend to use it kind of in three main areas. Acute inflammatory conditions such as if we get an inflamed flexor tendon or suspensory ligament branch. After an icing protocol, that's usually the first thing that we do. We find it very effective at pushing edema, both interstitial edema out of the ligament and then paraligamentous edema up the leg, and it's been very effective for that. It also works great for just myositis, muscle pain. We work on a lot of saddle seat horses that tend to get sore backs due to their head and neck carriage. And it's a very effective technique for us. It's non-painful, it's quiet, the horses seem to enjoy it. You can add heat with it as well. And so it's been good for that. More recently, we've been using on a lot of chronic joint pain in the competition environment, just as sort of a rescue therapy for a horse that's, you have a condition there and you've been managing it, but maybe towards the end of the show they get a little sore. It tends to be very effective pain relief for that. Our practice has a pretty strong seasonality to it. So during show season, each unit probably gets used anywhere from 4 to 6 cases a day. In the slower times, then obviously it doesn't get used as much, but during those down times is when we're doing a lot of rehab therapy, usually combined with some other regenerative medicine, and so we tend to use it as an adjunct therapy for that, as well as we're bringing these horses back into work and you're dealing with a little bit of low-grade inflammation. Unit, like I said, we've got multiple units. We've integrated it along with other regenerative therapies in our practice, and it seems like it works hand in hand with other devices such as shockwave therapy or regenerative laser. They all have their unique capabilities and times when we use them, and we've been very successful with it, and I would definitely recommend other practitioners, particularly in a sports medicine show environment. I think it's an excellent tool.